avoided when doing physical activities. That is why certain basic first aid for common unintentional injuries and medical emergencies are commonly needed to be practiced by everyone. Here we are going to demonstrate the basic first aid for common incidental injuries like muscle cramps, sprain, and heat exhaustion for emergency situations which can be used in emergency or crisis circumstances. To convey the basic first aid for having muscle cramps, we must first understand what it is. A muscle cramp is an excessive contraction of one or more muscles that happens unexpectedly. What may be the possible cause of this? Muscle cramps may indeed be caused by muscle tension or merely maintaining a posture for an extended amount of time. It may also be muscle that has been stretched or overused. It can be dehydration, electrolyte dysfunction such as magnesium, potassium, or calcium, or merely not having enough blood getting to your muscles. We really had no ways of predicting when this will happen to anyone, but if this scenario ever occurs to you or any of the people that is around you, always remember these basic steps. First, search for an open, secured area. When a person ever encounters a muscle cramp, have him or her lay down in a secured area. Second, assess level of consciousness. Check the person's condition. Third, go over the ABCs. Check the airway by tilting the head back gently and pull the chin forward. Feel the breathing, check the pulse. Fourth, do a counter stretch. Massage the affected area and do counter stretch. Fifth, use a cold compress. Apply a cold compress to the affected area. Sixth, stay hydrated. Let the person drink a lot of water to prevent dehydration. And lastly, take a rest. Don't let the person do any work. At this time, we are going to explain the simple first aid for sprain injuries. A sprain happens when ligaments, the tough bands of fibrous tissue that bind two bones in your joints, stretch or strain. Sprain injuries are basically accidents that mainly happen because of environmental conditions, fatigue that does not actively support the body, and other footwear or sporting equipment. If this ever happens to you or to anyone around you, here are some basic first aid treatment that we should always remember. Original care for a milder mid-foot sprain meets the RICE rule. The acronym RICE stands for Rest, Ice, Compression, and Elevation. These techniques are commonly prescribed by physicians to minimize swelling and discomfort in the days after an injury. The first step to aid healing for sprain injuries is rest. Rest the injured or sprained area. The benefits of resting the sprained area and using a brace to help protect the area that is negatively affected are also crucial for recovery. Returning to athletics or other practices too fast due to an accident increases the probability of re-injury. The area should be iced. To help reduce swelling after an injury, use a cold pack, a slush bath, or a compression sleeve filled with cold water. Compression. Use an elastic wrap or bandage to compress the area. Wrap a bandage over the injured area to cover it. The bandage should be sturdy, but not so stiff that it digs into the skin, aggravates, or makes the area numb. Compression assists in the stabilization of fractured joint as well as the prevention of swelling. Elevation. The accumulation of fluid in a sprained area can be reduced by elevating it. This may help reduce pain by reducing swelling. If the fractured area is injured in the ankle, try sitting with your foot and ankle propped up higher than your heart on pillows. Use pillows or footrests to elevate the foot and ankle when resting or sleeping. To illustrate basic first aid for common incidental injuries like heat exhaustion, let's take a look at what this is all about. Heat exhaustion is a condition that occurs when your body overheats, resulting in heavy sweating and a rapid heart rate. Heat exhaustion may occur unexpectedly or steadily, usually as a result of working or playing in a hot weather, heavy sweating, or dehydration. People who are unaccustomed to humid, high temperatures are more likely to suffer from heat exhaustion. One of the heat-related syndromes is heat exhaustion. The severity of the symptoms ranges from moderate heat cramps to heat exhaustion to potentially lethal heat stroke. Dizziness and discomfort are some of the symptoms, as are excessive sweating, faintness, confusion, weakness, and a heavy, weakening pace and breathing. If we are able to encounter this kind of common accidental injury, these are some actions and steps that we should apply and reminisce about in order to avoid any precautionary measures to the patient and his condition to this sort of matter. Number 1. Stability of the scene to conduct first aid. Move the person out of the heat and into a shady or cool place. Number 2. Consciousness level. If the casualty is still conscious, give them a hypertonic sports drink or oral rehydration solution. However, if they have fallen unconscious to the situation, place the person on their back and slightly elevate their legs and feet.
Wave Beats music.
Number 3. Check A, B, C. Checking the airway by tilting the head back gently and pull the chin forward to assure if there is nothing blocking the air. Feel the breathing by your ear. Check the pulse. Take off any clothing that is too tight or too bulky for the victim to wear to prevent the condition to be more difficult. Spraying or sponging with cold water and fanning the person will help to cool them down. Number 4. Monitor their level of response. Number 5. Emergency calls for precautionary measures. If the situation seems to be getting worse, immediately call emergency medical services like 8911 for NDD, RMC, and 911 for ambulances. First aid is urgent medical treatment given to a person who has been injured. The aim of the first aid is to avoid accident and damage in the future. First aid can be needed in extreme situations to keep the victim alive. Prevention is the foundation of first aid preparation. If a person who has been qualified to perform first aid comes across a victim in this area, prompt steps should be taken to save lives. Provides therapeutic benefit. Knowing that you can save your own life as well as the lives of people you care for or those who are in trouble during an emergency encourages you to feel more at ease and safe. Awareness of first aid leads to a stable, secure, and safer society, as well as instilling trust in individuals, their family, peers, and associates. In coping with trauma cases, having a basic understanding of first aid is highly useful. Not only do they offer medical support, but they also exude trust, which is very useful